contraction and all, they also gain more weight. And not only that, okay, they also gain more weight because they get to breastfeed more. Okay, I'll be talking about this in a moment. But in summary, if you look at the whole picture, evidence shows that the benefits of kangaroo care is so profound. And in fact, so profound that the WHO has declared this essential care for premature babies. And even the International Pediatric Association endorses it. I mentioned just now that kangaroo care increases breastfeeding. So how does it increase breastfeeding? One of the reasons is because of that skin-to-skin contact between mommy and baby's chest. During kangaroo care, the baby's chest, the bare skin on the baby's chest is touching mommy's chest, especially chest, right? Okay, and this is called, as I said, skin-to-skin contact. When this happens, a hormone called oxytocin is stimulated in mommy. Have you heard of oxytocin before? Well, oxytocin is also known as the love hormone, and it's a powerful stimulator to produce breast milk. So when a mother and a baby does kangaroo care, the mother will produce lots more breast milk compared to what happens if the baby is separated from the mother. And we all know how important adequate milk production is to sustain breastfeeding. Another reason why kangaroo care increases breastfeeding is because the baby's early feeding cues are easier recognized. Right. When a baby is ready to feed, how does he tell us that he wants to feed? Do you know how to recognize this? Well, I think we all know this one, right? When he starts to scream and cry and gets very, very upset. Okay, we know he's hungry. But do you know that this is already a very late cue? When the baby cries like this, he's already very, very hungry and maybe even too angry to feed. Let me go through how to recognize baby language here. How to know if the baby is telling us that he's hungry. Okay, these are actually early cues to hunger. Just opening the mouth and closing repeatedly, maybe turning the head to look for the mommy's nipple. All right. If he can talk, he's going to say, "Mommy, I'm hungry. You should feed me now." As if he can talk, but he can't, so he's just showing you these signs. If you miss this early cue, because maybe you're too busy or you didn't notice or you were far away from baby, and you end up not feeding him, he usually will just go back to sleep. But when he wakes up, he's going to be even hungrier, right? Now, he will show you that he has increased movements. He starts to stretch more, trying to get his milk. He puts his hand to his mouth, right? These are mid cues. If he can talk, he's going to say, "Mommy, I'm really hungry. You better feed me now." If you still didn't notice this, well, he won't be too happy, but he will still go back to sleep. But this time, when he wakes up, he's not only going to be extremely hungry, he will also be very angry. He will start to cry. That's what I said. Crying is a late cue. He's going to be very agitated. He might even turn red. Okay. And if he can talk, he's going to say, "Mommy, why didn't you feed me earlier? I'm now too upset to feed. You better calm me down first. Otherwise, I won't feed." Right? A lot of time then is needed to calm him down. And even then, just like children, they might sulk and not want to feed. Okay? Merajuk lah, maybe merajuk. And this will then be a very difficult time for mommy and baby. Right. So how easy is it for feeding cues to be seen? I mean, big babies, term babies is easy, but for premature babies, how easy is it for the feeding cues to be seen? Well, we must bear in mind that it's not easy at all. Premature babies' feeding cues are very subtle. They are not obvious. So unlike that big term-sized baby I said who will cry very loudly, premature babies might just, move their mouth a little or maybe just lick their lips. They don't have much energy to do all the things that a term baby can do. Move his hands to his mouth, or maybe arch his back slightly, or just open his eyes. A lot of prime babies don't open their eyes. So when these very, very subtle cues are shown, and if the baby is in an incubator or in a cot, do you think it will be picked up? Most commonly, it's very easily missed. And when the prime baby's feeding cue is missed, they might not have the energy to wake up and cry for feeds again. They just continue to sleep. And that's where they lose an opportunity to feed. That is why kangaroo care is so, so important. On mommy's chest, and these cues are easier picked up. Like when he starts to lick his lips, the mommy can see, right? Or when he opens his eyes, or like this one, put his hand to his mouth. Mommy can see. And very quickly, when mommy sees this, mommy can easily shift baby to breastfeeding position for the baby to start breastfeeding. But just imagine if like earlier I said, the baby was in an incubator or in a cot, okay, in the ward, let's say. You know how busy the nurses are in the wards? They are really, really very busy. So they might miss the cue. And even if she happens to see the feeding cue, all right, by the time she says, ma, datang, anak, baby nak susu. Okay? By the time the mommy gets to the baby might have fallen asleep again. Right? That's how premature babies are. They fall asleep very fast. And when they wake up, they don't stay awake very long. And that's one of the reasons why they have such difficulty gaining weight unless breastfeeding can be sustained, like what happens in kangaroo care. Not only that, premature babies also tire very easily when feeding. They suck just a little while. They don't have much energy. So they just suck for a little while and they go back to sleep. So what they need is actually small, but very frequent feeds. They say little, but often. So again, imagine in a busy ward, how difficult this will be. Someone has to be standing by the incubator, pick up the feeding cue, then call mommy to come, and take baby out of the incubator, and then feed him for that little while, and then put him back in the incubator. And in a short while, he has that feeding cue again, and you call mommy again, and mommy comes, take the baby out, and it's so much more difficult compared to baby is just on mommy's chest, right? And therefore, facilitating actually and sustaining breastfeeding is so much easier with kangaroo care. And for babies that are too premature, too small to start breastfeeding, kangaroo care allows them to have a head start in learning and practicing how to breastfeed. Like this baby here, he's too premature to actually start breastfeeding, too small. But he can start learning how to lick the breast and the nipples. We all know practice makes perfect. So this licking the nipple and the breast will help put him at a head start to breastfeeding when he's grown old enough to do it. He will be so much better prepared to breastfeed compared to babies that stayed in an incubator without the luxury of kangaroo care. And not only that, these breast licks also help stimulate mommy to make more breast milk so that she will have adequate supply for him. And all these help initiate breastfeeding for the baby. Another very big reason why kangaroo care increases breastfeeding is because babies with kangaroo care have less infections. And if the baby doesn't have infection, he's well, he feeds better. I mean, when we are sick, we don't have appetite to eat too, right? Okay. So why does infection become less if there is kangaroo care? Well, the reason is very obvious. They get more breastfeeding, right? And we all know breast milk has all the protective antibodies to prevent infection, right? Breast milk also has all the correct nutrients needed by the premature baby to grow. And when the baby grows and his weight increases, he's less likely also to fall sick. So many, many reasons why a baby has less infections with kangaroo. So I'll show this in a diagram again with you. So the skin-to-skin contact, all right, helps the mother makes more milk, and baby being so close to mommy, the feeding cues are easily recognized, and then the baby gets more breastfeeding. With more breastfeeding, you get less infection because the baby grows better, all the antibodies and the immunoglobulins. And with better growth, the baby gets discharged home faster. Yay, right? And when the more babies get discharged home faster, the ward also has less overcrowding. I'm sure you know overcrowded wards are a very big source of infection. So with less overcrowding, again, you have less infections. And then when you have less infection, you grow better. When you grow better, you have less infection again. When you have less infection, you breastfeed more. When you breastfeed more, the mother produces even more milk, and the whole cycle just repeats itself. It's really, really very beautiful, right? With Kangaroo Care, baby's heartbeat and breathing is also much more stable. And therefore, he sleeps much better, feeds better. And when he sleeps and feeds better, he grows better. And growth not only in terms of body size, but also in brain maturation and brain development, brain growth. Okay? And then we said earlier on also, sleep and growth also helps to improve his immunity against infection. Right? On top of that, baby is colonized with the mother's normal flora, okay? Which not only protects the baby from infection, it also has huge impacts on the baby's microbiome and also his future health. This is a very long topic. I don't think I will be covering this in today's presentation. So in summary, Kangaroo Care establishes, facilitates, and sustains breastfeeding, which will in turn reduce infection and also improve growth and maturation, and also reduce hospital stay. And all of these ultimately reduce the risk of death for all these vulnerable babies. So please, I hope you all do not confuse Kangaroo Care with baby wearing. Okay. This is baby wearing. This is not Kangaroo Care. Can you see where the difference is? Can you all see? The main difference is because of this layer of clothing, which prevents skin-to-skin contact between baby and mommy. All right. So when you do Kangaroo Care, there should be nothing between the baby skin with the mommy skin like this one. He's actually naked here and put on mommy's bare chest. Okay. Skin-to-skin contact here, skin-to-skin contact all the way here. Right. This is Kangaroo Care, not this. Right. You would have noticed I said I have not used the word kangaroo mother care. This used to be the original name because this form of baby care started off with mothers. However, studies have shown that kangaroo care can be done by anybody, any family member, and the benefits to the baby is still as good. All right. So this is a pair of premature twins born in Penang Hospital. Okay. This one got Kangaroo Mother Care, and this one got KFC. Okay, not Kentucky Fried Chicken. This is Kangaroo Father Care. Right. This is another pair of twins. Okay, this one got KFC. Okay, and this one got Kangaroo Brother Care. Okay. It's just so heartwarming, isn't it? To see this family bonding so well together. Really, really heartwarming. Okay, so here are even more parents doing Kangaroo Care. These are two proud KFCs. And this is the mother who is doing Kangaroo Care for a premature baby who is still connected to a machine to help the baby breathe. You notice that the mother has a mask on because this photo was taken during the COVID pandemic. So we'll be talking about Kangaroo Care during the COVID pandemic soon. Okay. Normally, you don't need any mask. Okay. But during the COVID era, this is the one that is recommended. Okay, all this while I've been telling you how kangaroo care benefits pram babies, premature babies. What about term babies? Can kangaroo care be done for term babies? What do you think? This photo says it all. Right, this is a term baby. You think he looks like he's benefiting? Well, I think so. Okay. Look at the bonding between baby and mommy. And when he's bonding like that, mommy is colonizing baby with a normal flora. And the skin-to-skin contact is going to stimulate mom's mom's milk production. And so many more other benefits. So can kangaroo care be done for term infants? Yes, okay. It's just that, the evidence shows that the benefits are most profound for preterm and low birth weight babies. That means babies that are born less than 2 kilos. That those babies benefit most. But it doesn't say that, other babies don't benefit. So above 2.5 kilograms, yes, the baby can still do kangaroo care like this one here. All right. Some people ask then, how long can you do? Well, for pram babies and low birth weight babies, then at least until the baby is 2.5 kilograms, or 2,500 grams. Okay. But for term babies like that, you can do it for as long as you and baby like. Okay. Well, up to a certain age, the baby won't want to be doing it anymore, actually. Okay. Like what you see in this kangaroo. All right. Let me just show you the kangaroo. All right. So, baby kangaroo is out. See, he's already now outside playing. Does he want the mommy actually wants him to go out already? Okay. But he's making a somersault there. But he says, I want to go in for a while still, I think. Yep. So he is still going back into the pouch. Right? So yes, as long as baby wants and mommy's okay, that's fine. Okay, as long as you want, but at least until the baby is 2.5 kilograms. Oh, sorry. Okay, I would like to express sincere thanks to all the parents who consented to have their photographs used here, to the Kangaroo Mother Care Foundation Philippines and the Sea Urchin Project team for more photographs, and as well as some of the slides used in this presentation. I also hope that you too will help advocate for kangaroo care. Thank you very much for listening, and may everyone be safe and healthy. Thank you.
Thank you so much, Professor Fong, for that wonderful and inspiring talk with so many lovely pictures as well as the videos. So we'll move on to questions. Do any of the participants have any questions? Okay, so to get the ball rolling, can I ask the first question, Prof?
Sure.
Okay, so Professor Fong, just wondering how long can the mother do the kangaroo care? Once she starts, how long should it go on for?
Right, that's a very good question. I mean, I thank you for asking that. So the recommendation is when the mother does kangaroo care, I mean, anything is better than nothing. That's my motto. Something is always better than nothing. But the recommendation, if possible, for at least 1 hour. Because when the baby does kangaroo care, especially for the pram babies, they tend to fall asleep, right? So if you just put the baby for, let's say, 10 minutes, baby falls asleep, you take him out, you wake the baby up. And that's not good for brain development, growth, and a lot of other things, right? We want the baby to have long, uninterrupted sleep. And they sleep very, very well on mommy's chest while doing kangaroo care. So my suggestion is, where possible, at least do kangaroo care if you want to do minimum 1 hour if possible, okay? But for most benefits, right, the evidence shows that if the baby gets to do kangaroo care for 6 hours a day, that's when the benefits are most profound. Okay, 6 hours doesn't mean you have to do it continuously for 6 hours. All right. You can do it for 1 hour and then you put baby down and then pick the baby up again. Or you want to do 2 hours, 3 times a day, anything to your comfort and to your convenience. All right. But minimum 1 hour, and hopefully you can reach at least 6 hours a day. There are countries actually that have the baby on for almost 23 hours. Okay. The only time the mother takes the baby out is when the mother needs to go to the toilet. So when you go to the toilet, it's recommended that you take baby out. All right. But when you take baby out, you don't have to put baby on the cot. Daddy can take over and do kangaroo care with baby. I mean, let's give daddy or grandpa or grandma or a brother or sister a chance to, right? I hope I answered that question.
Yes. And in fact, you answered my next question as well as to how many times a day kangaroo care can be done. And you say it can even be done up to 23 hours in a day.
Yeah, some people do that actually. Some people actually do that. I know in a few countries and in some, I don't have a chance to share here, but I have got video stories from people who actually share how they actually do it for 23 hours a day. As I said, the only time they take the baby out is when they go to the bathroom for a bath or when they need to relieve themselves.
Okay. I think there was a question from the participants as to can somebody else take over the care, which I think you answered just now.
Yep, anyone, daddy, auntie, uncle, grandparents, as long as the other caretaker is healthy and strong enough. You saw that little boy there, the big brother there doing kangaroo care. Yep, anybody, as long as they are, willing, and of course they have to be healthy. Anything else?
Dr. Mahaila,
Yes.
Dr. Mahaila, they have a question in the comment chat in the Facebook. When is the most important time can do the kangaroo care?
When is the most important time? There is actually no one time. Anytime mommy wants to, actually. I don't think there is a certain time that you need to do it. Anytime you are available, just put baby to chest. So I don't think there is a certain time that you need to do kangaroo care. As I said, where possible, the longer the better, but anytime to your convenience. I think now it's not that easy in the hospital. I think the next speaker will be covering because of a lot of limitations in the hospital. I mean, our hospitals are actually being overwhelmed. So any chance you have to do kangaroo care, you grab it. But at home, okay, if that question is referring to at home, then again, also anytime. The more, the better.
Okay. Prof. Fung, another question.
Right.
I think as you showed in one of your slides, it's also encouraged that even babies on respiratory support should participate in kangaroo care. Unfortunately, sometimes the parents feel very nervous and keep looking at the saturation monitor. How can we overcome this issue?
Yeah, that's not easy, and it's understandable. Actually, the parents are really scared, is it? I mean, to most people's minds, the machines are superior. I mean, this is so primitive, put on the chest. What's going on, isn't it? And that's the mindset of a lot of people. So I think to address that, a lot of things are needed. Actually, I think way before kangaroo care can be started. So kangaroo care can be done even if the baby is on the machine helping him breathe, as long as he's stable. That means his heart, his blood circulation and all are stable. Even if he needs a machine to help him breathe, he can do kangaroo care. But earlier on, the baby might be more sick. So when the baby is still more sick, I think we can actually start to prime the parents, tell them about kangaroo care. Because to some parents, this is the first time they've ever heard of it. And it's really very scary. Just imagine they haven't seen their baby before. First time they see the baby has all these tubes and wires and all. And they say, Mom, you do kangaroo care now. Wow, I think I can imagine if I were the mother, I'm going to be terrified, isn't it? So I think way before you start kangaroo care, I think we should share awareness about this thing called kangaroo care. Not many people have heard about kangaroo care. I still remember, when I talk to family members, then they would say, kangaroo? I mean, I thought you were a doctor, not a vet. All right, so, I want to share this, okay? And then you tell them about how you're going to do it. So you prime them even before that day actually comes. And when the day comes where the baby is stable, despite all the wires and all, hopefully they are more prepared. And yes, the mother will be scared. We have to be understanding then, okay? We don't say, "Ayo, why are you so scared?" Okay, yeah, they're going to be scared. All right, we have to support them. That means we will be nearby. If the mother is worried, we address the concerns. We show them, "Yep, this is all right. The baby's all right." But it's also good that the parents monitor for us also. I mean, if the mother notice that the baby looks a bit different, she can alert us so that we can come and see. I think all this might hopefully help. But the bottom line is awareness is very important. And that is why I'm very, very happy and I very appreciate the organizers for asking me to come and talk today so that more people have heard about kangaroo care. It's not so foreign to them. And when it's not so foreign, it's easier to be accepted. And hopefully it's not so scary for parents. Have I addressed that question? Dr. Miala?
Yes, thank you so much for addressing all the questions and for the wonderful talk just now. And I'm sure all the participants really appreciated the talk. We will now go on to the next speaker, if there's no further questions. And
if there are, I'll be very happy to answer. Actually, this, as what you say, is something that is something I'm very passionate about. Why? The only reason is it brings so much profound benefits, not only to the baby, but also to the mother and the family. So, if there are any questions, any queries, please do not hesitate to ask.
Yes, thank you.
There is no silly question also. Thank you.
And if any of the participants want to ask anything else, please put it in the chat box. And I'm sure Professor Fung will answer your questions.
I will, definitely.
All right. So now we move on to the next speaker. And this is Dr. Fung Wai Cheng, who is actually Professor Fung's sister. So these two very sisters who are very passionate about both breastfeeding and kangaroo care. Dr. Fung Wai Cheng is currently a senior lecturer at RCSI and UCD and is still a visiting pediatrician at Hospital Seberang Jaya. She is a certified neonatal resuscitation program instructor, and she is also a Cochrane Systematic Review author. She has special interests in neonatal care, breastfeeding, kangaroo care, and thalassemia. And she is currently the secretary of the Kangaroo Mother Care Advocate Malaysia, or KAMI Foundation, which advocates for kangaroo care. So without further ado, I'd like to invite Dr. Fung Wai Cheng to give her talk on kangaroo care during this COVID-19 pandemic.
You're muted. You're muted.
Okay, can you hear me? Sorry.
Yes, we can hear you now.
Okay, all right.
Just put your slides on the slideshow.
Just hold on. Slideshow. Am I sharing? No. Okay.
Yeah, just go on the share screen.
Yeah. Can you see? Can you see my slide?
Yes, we can. Yes, just slideshow. Fantastic.
Okay. Thank you, Dr. Mihala, and good morning, everybody. Thank you for giving me this opportunity to share this topic. This is, Sorry, what happened? Stop share. This is the outline of my presentation. Evidence for kangaroo care during COVID-19, current recommendations, barriers to kangaroo care during the pandemic, and what can we do? Kangaroo care, as said earlier, is baby and his parent. Okay, we can see here. Okay, stay in skin to skin for prolonged periods of time. It's usually started in the hospital and can be continued at home once mother and baby are discharged. This, the earlier presentation has actually touched on how important kangaroo care is to all babies, especially the premature and the low birth weight babies. Okay, but now we are now in the middle of a COVID pandemic. Okay, and Malaysia is breaking records almost every day. Just yesterday, we have breached the 20,000 new cases record. So should kangaroo care be continued? Is it safe? So what I'm going to share today is based on the current recommendation available, and things might change as more data comes out, and we must adapt based on the latest evidence. So should it be continued? Now what we see here is that this paper says that COVID-19 is unlikely to occur, and allowing neonates to room in with their mothers and direct breastfeeding are actually safe, and that procedures when paired with effective parental education of infant protective strategies. So all this actually means that baby getting infected with COVID-19 from an infected mother is unlikely if correct precautions are being practiced. We also know that kangaroo care helps establish, facilitate, and sustain breastfeeding. And this is just so important for babies. Breast milk has protective antibodies that prevent infections, and that includes infection from COVID-19. Kangaroo care also promotes the feeling of well-being, not only for the babies, but also for the mothers. The oxytocin hormones released when doing kangaroo care actually calms both baby and the mother. So that's why it is so important in the current pandemic when stress and depression is on the rise. Kangaroo care and practice should be sustained. Because without kangaroo care, there could be separation of mother and baby. Here is the growing evidence that separating mother and baby in early life will have negative effects to our next generations. And these include mental, behavioral, and developmental problems to the babies, and these problems will persist until their adulthood. So therefore, WHO, World Health Organization, has recommended that breastfeeding, rooming in, skin-to-skin contact, including kangaroo mother care, could be continued, even if the mother has COVID-19. And this is based on the data showing that benefits of keeping mother and baby together substantially outweighs the potential risk of transmission. So in other words, the current evidence recommends that we avoid separating baby and mother whenever possible. Our own Ministry of Health has come up with this guideline that all of us healthcare staff are following diligently. These are some steps in the guideline that I would like to share with you. So here it says that boleh dilaksanakan. So bagi pesakit COVID-19, pemisahan bayi dari ibu boleh dilaksanakan jika keadaan tidak mengizinkan ibu dan bayi bersama. However, bayi pesakit disyaki disarankan untuk bersama, okay, setiap masa dengan pematuhan SOP seperti di lampiran A. So the thing here again here is that pesakit disyaki COVID-19, disarankan untuk memberi penyusuan dengan pematuhan SOP seperti di lampiran A. So they actually really encourage this one breastfeeding, okay, and also to have the baby together with the mother. So mengamalkan pendekatan ibu bersama bayi setiap masa. So if possible to let the mother to room in, and it could be as long as 24 hours. All right. So these are some of the steps that I would like to show you, the guidelines. Okay. And so in other words, so if the parents would like to do that, okay, we should always, give encouragement and support to be given to these parents with stable newborns, especially those with premature babies or babies whose weight are below 2,000 grams. And as mentioned, under the World Health Organization parents with COVID-19 who are well and who have no symptoms are also encouraged to do so. So as long as the baby is stable, the mother or father is well, kangaroo care should be encouraged, irrespective whether or not they have COVID. Our hospital's priority is also the people's safety and well-being. We need to follow strict standard operating procedures, which consist of, all mothers admitted for labor, they have to undergo this RTK antigen test for COVID and to prove themselves to be COVID and to be negative for COVID-19. Okay, and another thing here is that all adults should wear face masks all the time, okay, except during meals. There should be frequent hand sanitization and maintaining a good social distance. And this has been ongoing since early last year. These are some parents doing kangaroo care in the wards. Okay, if you can see, okay, there's a cap here. Okay, mask on. Okay, and then this is also a mask on. And before they actually touch their babies, these parents actually, washes their hands, and then they are actually wearing clean clothes. So this one can help. And they are being separated, far apart. Okay, so we also, for those mothers with COVID positive, okay, there are some hospitals who actually prepare, special wards for them, okay. These mothers are the ones asymptomatic, that is considered in the category 1 or category 2, so that these mothers can be with their babies. So this is something that some hospitals are doing to maintain to prevent separation between mother and also baby. And so now here we comes to barriers to kangaroo care during the pandemic. Okay, we have to understand hospitals are overwhelmed and overstretched now. There's actually lack of space in the ward for kangaroo care. And depending on the resources the hospital have, some have had no choice but to limit people in the ward, even the baby's own mother. I have to say that this has been a very difficult decision for the hospital. On one hand, we want the mothers to be with the babies. But on the other hand, not only there is not enough space in the ward, we also have to weigh between the possibility of transmission of COVID if the mother is an asymptomatic carrier.
Dr. Mahira, I think that we have a problem with connection from Dr. Cheng.
Yes, yes. I think it's an internet problem. So I hope that she will be able to rectify it. Can you hear me?
Yeah, I can
Yeah.
hear you. I think that's from Dr. Chiu Cheng.
We just have to wait for
Dr.
her.
Whiting.
Yes.
I think something went wrong with her computer. It hung up. She's restarting the computer. Apologies for the problem, the IT problem there. Mungkin komputer dia kena COVID kot. Dia tengah cakap COVID ni.
Okay, we can wait for Dr. Whiting.
Any participant has any questions or would like to clarify anything? Professor Fung is still with us. I think what Dr. Fung Wai Cheng said is very correct. It's very, very important to continue kangaroo mother care even during the COVID pandemic. But unfortunately, we are restricted by the
Apologies for
availability.
the problem. I think her computer ended up with problems. But while waiting for her to get back, any questions? I'll be happy to try and answer questions first while waiting. I think her computer needs oxygen a bit. Kena COVID. Puan Zuhaida?
So far, we don't have question in the Facebook. Any participant wants to ask want to ask question? Can
The question that during the pandemic, does the hospital in Penang allow kangaroo care? I think the best person to answer this is Dr. Mihala, actually, who's in charge of the neonatal ward. Dr. Mihala?
Okay, yes. I
think
actually...
you would be the best person to answer that question.
Yeah, thanks, Yu-Cheng. So I think as I was going to say just now, definitely kangaroo care is very advantageous even during... Can you all hear me?
Yes, I can hear you, Doctor.
Okay, so as I was saying just now, definitely kangaroo care is very advantageous during a pandemic because it helps in reducing the risk of infection, helps with breastfeeding. Unfortunately,
she's back now.
Okay.
Sorry.
Dr. Fung, are you ready to continue?
Yeah, where did I stop? Sorry.
You want to share? You're muted, are you? Can't hear you.
Again?
No, we can hear you, Dr. Fung.
Can you hear me? I don't think I'm muted.
Yes, we can hear you, Doctor.
Okay, sorry. Something, you see, during pandemic, my computer also got COVID virus or not. Today it's not working that well. I'm so sorry. So where did I stop? Sorry. Where did I stop? Hello? Can you hear?
Yes, I can hear.
Which slide?
Somewhere the SOP. Somewhere the SOP.
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 I think the slide number 14.
Number 14.
Yeah.
This one?
Yeah.
Oh,
Yeah.
okay.
That is your last slide this one.
This was my side. Okay. I'm just showing you that these are some parents doing kangaroo care in the wards. And what we can see here is that this mother is wearing a cap. Okay. This mother is wearing, a mask. Okay. And before they actually, touch their babies, they have to really, really wash their hands properly. And they have to gown up and also wear proper clean clothing. And these parents are seated far apart. So there is actually distancing between the parents. So this is it about it. Okay. And we also, try to help. There are some hospitals trying to help COVID positive mothers who are in the category 1 and 2. That means they are so-called asymptomatic or they have very, very mild symptoms. Okay. Some hospitals actually created special wards for them so that they can be with their baby, either for breastfeeding or for kangaroo care. Okay. And this is something about the barriers to kangaroo care during the pandemic. Okay, we have to understand hospitals now are overwhelmed and overstretched. There is actually lack of space in the ward for kangaroo care. And depending on the resources the hospital have, some have had no choice but to limit the people in the ward. And that includes the baby's own mother. This has been a very, very difficult decision for the hospital because on one hand, we want the mother to be with the baby. But on the other hand, not only there is not enough space in the ward, we also have to weigh between the possibility of transmission of COVID if the mother is an asymptomatic carrier. So everyone from the healthcare staff to the parents to the community, we all should have a mutual understanding that all decisions have made has to take many, many things into considerations. We really, really have to make sure that we follow all COVID standard operating procedures strictly. And here what we can see, all right, okay, you can see here, this father is doing it and this father is not adding on a face shield, all right? And there are some parents who actually wear double masks and these have to be worn throughout the kangaroo care while they are doing kangaroo care. Okay. Besides that, we also re-emphasize, frequent hand washing and also the distancing. Okay, and these seemingly little steps actually go a long way to reduce everyone's risk of getting COVID. And this is also very, very important to help our overworked hospitals from collapsing. Okay, so just a recap, we should support parents who have to be separated from their baby and help them to be closer to their baby once both baby and parent are at home, and then they should actually do kangaroo care at home. Okay. Everyone, healthcare staff, parents, and the community should have a mutual understanding that the decision made is for the best outcome for both baby and parent, and everyone should respect the decision that is being made. Okay. And another important step that you can help, are you all vaccinated? For those who hasn't, okay, have you registered yourself? All the vaccines, okay, are safe for pregnant and lactating mothers. And reducing your risk of COVID will not only protect your baby, but also your family, as well as our country. So my take-home messages would be, kangaroo care should be continued during the pandemic. The benefits of no separation outweighs the risk of transmitting COVID-19 infection to the baby. Okay, so if you are doing it, you are actually protecting your baby and perhaps yourself. Okay, and you can also continue your breastfeeding also. So but during this time, extra precaution is needed if the mother is positive for COVID-19, but whether. Okay, this precaution should also be done for those doing kangaroo care at home. And community and family support are important. So do get yourself and your family members vaccinated. I would like to express sincere thanks to all the parents, the Kangaroo Mother Care Foundation Philippines, the Kangaroo Mother Care Advocates Malaysia, and the Sea Urchin Project team for the photographs, some of the slides, and the information used in this presentation. We hope you too will also help to advocate kangaroo care, and thank you and stay safe, everyone. Thank you.
Thank you very much, Dr. Fong Pai Cheng, for that very informative talk. And I completely agree with you. Kangaroo care is the benefits far outweigh the risk, even during times of pandemic like this. I think the first question was from Dr. Juliana, and she asks, during this pandemic, are the hospitals in Penang able to allow kangaroo care? So probably I would be the best person to answer this, I think. So I think the ability to allow or give permission to do kangaroo care totally depends on the facilities available. So in hospitals where you have good isolation rooms and the mother and baby can room in together in the isolation room, then I think it's very much encouraged that the mother and baby should be together. Mother uses the proper precautions like face mask, hand hygiene, and continues with kangaroo care and breastfeeding. Unfortunately, I can speak for Hospital Pulau Pinang. At the moment, we are really overstretched. In fact, pregnant mothers are in the same ward as other COVID positive patients, and they will continue to be cared for in that ward. There is no dedicated special ward because there are just not enough wards. Many of other discipline wards, including the gynecology ward, has been converted to COVID ward, and including like ENT. So there's not enough wards to cope with even the number of COVID patients. But I think in some private centers where there are isolation rooms, yes, they are able to allow mother and baby to be together. So I think the ability to allow kangaroo care depends on what facilities you have in your hospital.
Yes, I totally agree with you, Dr. Mihala. I have been actually asking around before I prepare my slides. There are some hospitals whereby they actually converted places like a visiting lounge to become a rooming place for COVID positive mothers. So it depends on the facilities, whether there are actually space available or not, and whether they can actually maintain that social distance. Yes, there are some who actually converted the area to cater for kangaroo care, and they are actually still continuing kangaroo care in that particular hospital.
That would be a very good arrangement. But I think, again, it depends on the availability of wards to convert.
Yes, that's right.
So the next question is is there, I think the next question is that someone said that in hospital, we are having problems in convincing mothers in breastfeeding and rooming in because of the fear of transmission. So how would we handle this?
Well, I would say that we should, have good communication. We should really, show them, okay, these are the evidence. If let's say they continue breastfeeding and also, direct breastfeeding to their babies, and also to uphold, skin to skin contact with their babies. And the hospitals are actually, helping the parents, make sure that they are really wearing the mask, following the standard operating procedure. And just now in that particular paper, the risk, if let's say the standard operating procedure is being followed and practiced, diligently, then the risk of transmission is actually much, much lower. It's very, very low. So just, we need to talk. We need to, we have to acknowledge, okay, that yes, this is actually the fear, everyone's fear, all right? But if let's say we follow the SOP properly, then and then understand that the benefits actually outweighs the risk, then hopefully we are able to convince the mother to come in for breastfeeding and also rooming in.
Yes, I agree with you, Dr. Fong. Communication is very important. So, like you say, we need to teach mothers that by using the proper precautions, it's safe. And I think we also probably can reassure them and tell them that there are added advantages like the transmission of antibodies through breast milk, which will possibly protect the baby from COVID-19.
Yes. And that's through breastfeeding. So that is why, if possible, the parents are being allowed to come in, and these parents are who actually come in to provide direct breastfeeding or to provide express breast milk or to do kangaroo care. These parents should also be supported by the community and the family members. They should not be shunned. Oh, you're going there. You may get COVID. Making these remarks will not help such parents.
Yes, definitely. It's all our shared responsibility, like the theme for this year's Breastfeeding Week says. It's a shared responsibility to reassure and convince mothers that it's safe to continue breastfeeding during this COVID pandemic. There's another question for you, Dr. Fong. Is there anything that needs to be, that shouldn't be done or should be avoided during kangaroo care? I'm not sure whether the person means during the pandemic or overall.
Yeah, that's the thing.
Yeah. Perhaps we'll take it as overall.
Overall, okay. So if it's overall, well, we want, if possible, the minimum duration for a kangaroo care is actually 1 hour. So during that 1 hour, the parent should be, with the baby. They shouldn't take up the baby and then put the baby back in because they want to go to the toilet to ease themselves. So it should be at least 1 whole hour. And because of this pandemic, when they actually come in, they have to show that they are actually RTK antigen negative. All right, they're free from COVID, and then they should actually follow the SOP, wearing the mask, wearing face shield, and also wash their hands properly, and make sure that they are clean. Then only put the baby onto their chest for skin to skin. That means for kangaroo care. So that is something. Yes.
Yeah. If you go general, then actually there's nothing much that you have to avoid. I mean, if you need, like what Dr. Fong said, we try not to take them out. But yes, if you need to go to the toilet, you have to take them out. I don't think it's recommended that you go to the toilet doing kangaroo care. It's not hygienic and it could be potentially dangerous.
What I mean is that the parents should go to the toilet first.
Yeah.
Ease themselves first. Make sure that they are ready, they are clean, okay, and they can have at least a minimum of 1 hour with the baby. That's what I meant.
Yeah. So that's a good one. So that but anything else that you shouldn't do? I think nothing. So while doing kangaroo care, you can read your newspaper or read a book. You can be on your Facebook. But however, having said that, there is one thing that is recommended that you don't do though. Try not to play games too much because you can actually get too engrossed if you're actually on an online game. And we've read in the papers also how parents can actually neglect their children if they actually are too engrossed in the game. So yeah, I think Facebook and all that is not too bad, but it's something that will make you addicted and forget that the baby is actually on you. Maybe I would avoid that. But simple household chores like folding your clothes and simple things. I don't think it's a problem about doing kangaroo care actually. Hope I answered that question. But if you didn't, maybe you would like to be a bit more specific to know what you should. What you were worried about or what you were thinking about avoiding.
There's another question. How long is the time period for COVID mother after quarantine? Meaning that means the mother is actually COVID positive? Is
So
Julia?
if she's talking about, early on the talk actually covered that if the mother is COVID positive, but is actually healthy, otherwise, that means no symptoms, Kangaroo Care can continue.
Yes, and there are
the precautions.
And there are some hospitals who actually open up a ward, especially to house COVID positive mothers with their baby there, and these are the ones who are asymptomatic. So there is nothing to say what got quarantine or no quarantine.
So I think that the word quarantine and separation applies to every. Oh, sorry. Yes.
The question is that Kangaroo Care can start after the person or mother know that she is free from COVID?
Yeah, even if the mother is COVID, also can do already. So if mother is free from COVID, lagi boleh buat.
Yes, that's right. Should be encouraged, because during that time, when she is very ill, there's a definite separation. So when she is now much better, and then in fact she's now free from COVID, then by all means she should actually, quickly do Kangaroo Care, do the skin to skin. And I would like to add that if, let's say, the mother is very ill with COVID, let's say, all right. So, and during this time, because there is separation, we have to separate mother from baby. So we should always look for other family members. Perhaps the father is COVID negative and he is well, all right. So the father should come in to do the Kangaroo Care. And if, let's say, the baby is at home, then perhaps, other family members who are actually, COVID negative, and they are actually well, they can actually do the care. So that there will be a continuation of skin to skin. All right. This should be there. And during this time, if, let's say, the parents and the mother who is warded because of COVID positive and quite sick, if, let's say, the mother is not so well, then if, let's say, the mother is feels better but is still positive and just on the road to recovery, she should be encouraged to express her milk so that she can still continue to so-called give her milk to her baby, which has also benefits. Okay, and during this time, because there will be a separation between mother and the baby, so there are some hospitals who actually allow the parent, the mother who's warded, and the baby perhaps somewhere else at home, perhaps to have some how do I say video, so that they stay connected. And when the mother is actually well, free from COVID, already recovered from COVID, the baby should be immediately be given back to the mother for skin to skin and breastfeeding. Have I answered the questions? Are there any other questions? She wants to know about the do and don'ts. You should avoid using phone during Kangaroo Care.
This is back to the previous question. What we shouldn't do or should avoid doing. The question is, should we avoid using phone during the Kangaroo Care? Handphones.
Use for usual. Pick up a call, send an SMS, or go and surf the web for a little while. I think it's fine.
Yeah.
We probably not for hours. Maybe. It's not even good for the mother. So it's not an absolute contraindication. It's just that picking up the call. Someone call you pick up the phone and chat for a little while doing Kangaroo Care. I don't think it's a major problem. Not that I know of, anyway.
May I know what is the person's fear? Is there, I mean, perhaps we don't see her point or your point. Is there anything that is of concern?
So if the concern is about radiation, I mean, phone's radiation near a young child, I mean, I don't know how to answer that. I personally won't speak for a long time on a handphone if I have a baby near me. But I don't know about the evidence for that, that's all. If you're talking about a landline for prolonged time, I don't see any reasons why not. You can sembang as much as you like.
Yes, the fear she's worried about is radiation.
Yeah, so if you're worried about radiation, yeah, then don't use your handphone, use the landline. Use the landline.
Or do something else, you know.
Yeah.
And in fact, if let's say they are doing the kangaroo care with the wrap, then the hands can be, you know, somehow a bit more free, okay, because the wrap will be, you know, quite securely tying the baby together with the parent, okay, and perhaps, you know, one hand can be free, and just for a while, two hands can be free, you know, something like that. That is something that can be considered if, let's say, someone would really, really want to do kangaroo care for a longer period of time. So minimum is 1 hour, and to get the maximum benefits, it should be for at least 6 hours a day.
Any other questions?
Thank you, Dr. Fong. I don't see any other questions.
You all to ask, and I do see that there's quite there's many of you here. At least got 23 participants here. So 135. Sorry, how come here I only see 22?
Yeah.
Facebook. Oh, okay.
Facebook,
Sorry.
we have 135.
Oh, I see.
Through Facebook.
Oh, okay. So
really sorry about the technical issue. Also, earlier on, I think my computer also got muted, so I wasn't hearing people talking. So I apologize if I interrupted anyone. I didn't notice that. I couldn't hear anybody. Suddenly, everything was just quiet.
any others from Facebook that you like to, or perhaps you all can tell us about your fears, your thoughts, or anything that we can actually, you know, discuss over here. Anything about, you know, kangaroo care, COVID-19, breastfeeding. Into
I think in this pandemic, everyone is still very confused what to do and what's right and what's wrong. And in that sense, your talk, I hope, gives people more confidence and encourages everyone to that kangaroo care is very beneficial and safe to do even during this COVID pandemic, if facilities enable us to. So like in the private hospitals, and if they have an isolation room, then it's quite safe to do kangaroo care, even if you're COVID positive.
In fact, and I think there is this recommendation that says, you know, when you're in the during the COVID pandemic, we should show social distance, everybody. But the only pair that you should not social distance is mommy and newborn baby. These two must be together all the time. Do not social distance a mommy from her newborn baby.
Yes, totally. Thank you so much, Prof. Fong, as well as Dr. Fong Wai Cheng, for both the very enlightening and informative talks. I'll now hand over to Puan Zuhaida.
Okay, and thank you, Dr. Maila. Hi. Thank you, Dr.
There's one more
Maila.
question, I think.
Oh, okay. We still have a question. Can Dr. Julaina speak up the question?
Yeah,
Because,
the question
our
from
speakers,
Janaki. for breastfeeding, is there any preparation prior to delivery for breastfeeding, knowing some mothers have difficulties in having enough breast milk supply or production?
Oh, this is regarding breastfeeding.
Yes.
How to what do you call increase breast milk production? Is that the question?
Yeah, anything we can do, I suppose, antenatally before delivering.
I think it all goes down to education. Antenatally, I think breastfeeding education will be very important, where we share with mothers, not only importance of breastfeeding, because a lot of mothers actually know it's important, but they don't know how to do it. So early skin to skin contact, I think someone mentioned that earlier. Also, the moment the baby is born, there should be skin to skin contact between mommy and baby. Lagi best if it can be prolonged. Okay, that will definitely enhance breastfeeding. Of course, kangaroo care, you can do it immediately, like also very good. That will increase breast milk production, sorry. And then frequent feeding. I think that's what all the baby-friendly hospitals are doing, skin-to-skin contact, initiation of breastfeeding within the first hour. So put the baby skin-to-skin, and when the baby is ready, he starts sucking. And then frequent sucking, because your milk the more the baby suckles, the more the milk production is there. Make sure, of course, that the positioning, how you position baby is correct. And make sure, of course, it's not as easy as putting baby to breast. By the way, everybody thinks breastfeeding is very easy. But personally, having gone through it myself before, it's not as easy as what I read. I had to learn. My baby had to learn. So yeah, mommy and baby have to learn how to position properly, and baby has to learn how to attach properly. If baby is not doing it properly, we have to guide the baby and the mother so that baby attaches well to the breast, so that he can suck well. Effective removal of breast milk from the mother. And I think all these simple steps will definitely help increase breast milk production. Anything else to add?
And the parents, perhaps, if let's say they do face some problems, knowing whether they have sufficient milk or not, or problems in doing a proper positioning, unsure whether is it good attachment, do approach someone who can actually help them and guide them. We have also lactation consultants around, and I'm in Penang Hospital. We the breastfeeding lactation team is there to help and support. And then we also have got the penyusuan susu ibu, the persatuan. So the help is there, and they should always open their mouth and seek help.
Okay, Doctor. Actually, we still have two more questions. So which I read from the comments in the Facebook. After delivery, some moms cannot room in and skin to skin during this pandemic. Maybe doctor can share how to overcome this stress from this situation.
Oh, susah. That's not easy, actually. If for any reason, either ward's not enough space or whatever the reason, the mother has to be separated, yes, it's going to be very stressful. What can we do, or what can the mother do? I think, one is that she has to keep a positive mindset, that things will be better. The baby hopefully will be soon back to her. But at the same time, I think expressing milk, thinking of the baby, of course, you can always think about your baby. In a positive light, the baby also doesn't want you to be sad. If you're more sad, your milk production will come down. And when baby is ready to be back with you, you might not be there to, in your proper frame of mind to help baby. So I think the only thing I can say, prayers. Some people go for meditation, but at the same time, express milk, because by expressing milk again, you stimulate oxytocin production, and oxytocin is a very calming sort of hormone. It helps calm you down. It gives you a feel good. It's a love hormone. It makes you feel more loving. It makes you feel more not so stressed, hopefully. And of course, knowing that you're giving your baby milk gives you hope, gives you strength. Hopefully that you're doing something good. It sets you in a very positive mind, and hopefully that will help tie until the period that the baby can be handed back to mommy.
Yeah.
That's what I think.
Yeah. Dr. Fong, you want to add something? You want to add, Dr. Fong?
No, I totally agree with what Prof. Fong has said. Okay, encourage the mother to express the milk, but the mother has to take care of herself first. Okay, and then whenever she feels better, express the milk. And because the mother will be in the hospital, and then the baby could be warded. All right. So from time to time, perhaps the father can come in to get the express milk and pass to, or the nurse will actually go to the mother to get the express milk for the baby.
Okay, thank you, Dr. And then one more question: to vaccinate a pregnant woman can start at what POG? Maybe Dr. Fong and Dr. Sujin want to answer this question, and then we have also Dr. Juliana, our ONG. Maybe can say something.
Actually, I've already replied in the Facebook chat. The question was, when can we vaccinate the pregnant woman? So I think Dr. Fong had actually put up the vaccination chart. So the first dose can be within 14 to 33 weeks. And then the second dose will follow. If she delivers, then we give after delivery. If she hasn't, then we follow the date that she's scheduled to.
Okay. Okay. Dr. Fong, Dr. Cheng, you want to add? No, I think that is our guideline for the
Yes, follow the guidelines.
Follow the guideline. Okay, I think we have finished with all the question. I think also we have a very fruitful and very interactive Q&A session from the participant. Yeah, so before I want to say thank you to Dr. First, I want to say thank you to Dr. Mahala as for moderator and very impressive session. I know Dr. Mahala is very tight with her task in the ward. Thank you so much, Dr. Mahala, for your commitment today. And then also thank also for Dr. Fong Chiu Cheng and also for Fong Wai Cheng. For the very informative talk on the Kangaroo mother care. We hope that all the inputs will be very valuable to us in supporting breastfeeding practices among the mother. Okay, thank you so much for your commitment today. Okay, Baila.
For the invitation.
Thank you
for inviting.
Okay.
And thank you for sharing.
Okay, thanks. Okay, now we come to the end of our webinar. So baiklah, before saya menyudahi webinar ini, saya ingin mewar-warkan dahulu our next webinar will be on 13 Ogos, on the 13 August, which will be on 10 to 11 AM dengan topik penyusuan susu ibu tanpa kelahiran, kesedaran dan persediaan, or breastfeeding without birth, awareness and preparation. So our next speaker adalah Dr. Nur Syamlina Cik Abdul Rahim. He is a nutritionist from Institut Kesihatan Umum KKM. So jangan lupa, this is our, now kita tayangkan pada slide, pada screen, iaitu our next webinar series. So saya mengharapkan semualah yang berada di sini ataupun yang tak dapat berada di sini, anda juga boleh sharekan informasi ini berkaitan dengan our next webinar series yang akan berlangsung pada 13 Ogos, itu pada minggu hadapan. Okay, so tuan-tuan boleh mendaftar dengan mengimbas QR code pada slide yang ditayangkan. Dan jangan lupa mengikuti Facebook Live Nutritionist Penang atau Facebook Making Penang Breastfeeding Friendly atau Facebook Jabatan Kesihatan Negeri Penang pada tarikh dan waktu yang dijanjikan. Okay. So now kita sampailah pada sesi akhir webinar. Saya bagi pihak Jabatan Kesihatan Negeri Penang serta pembimbing penyusuan susu ibu Pulau Pinang, PUI 3 SIP dan juga Making Penang Breastfeeding Friendly MPBF abang mengalu-alukan penyertaan semua peserta pada hari ini. Kita mendapat very good respon from the peserta. Okay, so sebelum saya berakhir, kita kongsikan dahulu QR code untuk sikit penyertaan di layar. Okay, so QR code ini akan dipaparkan di layar selama 10 minit. untuk memberi peluang kepada semua peserta untuk membuat imbasan ke kod ini dan akan mendapatkan sikit penyertaan. Okey, terima kasih semua atas kesudian untuk menyertai kami di webinar series sempena World Breastfeeding Week atau Minggu Penyusuan Susu Ibu Negeri Pulau Pinang. So we hope that everybody enjoy it and jumpa lagi di seri webinar seterusnya. Sekian, terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Sâu Giang 没有的，你也不可以动，是你在面。
Kenapa ada orang cakap invalid? Kak Zu pun tak boleh masuk? Boleh pula.
So, the opening. Tadi dia tu terganggu dengan sound. Tapi dia
Okay. Nanti boleh kan? Boleh.
you.